This is the fifth Clusters4health breakfast. Please check in the lowest part of your screen that you have the right interpretation or translation. Select the translation like Joanna says in the chat by clicking on the translation icon at the bottom of it's the right bottom of the screen. I have it in my screen like 3 additional dots. Then I click there, and then you can choose your interpretation or translation language. Again, thank you very much for joining the speakers, the distinguished speakers that we have today. And we have Clara that will, from BioCat, also will guide you in this breakfast today. So can we have next slide, please? Yeah, so we are your host today, and we also want to give the floor to our distinguished institutional representatives to give you this welcome. So please, Dr. Josep Pujante, on behalf of the government of Catalonia, the floor is yours.
Thank you very much, dear Montse. Ladies and gentlemen, dear friends, good morning to everyone. On behalf of the Minister of Health of the Government of Catalonia, Dr. Olga Pané, I'd like to give all of you a message of welcome to this important seminar, Breakfast with Clusters4health, Public Sector in Transition, Modern Governance for Health, organized by BioCat and led by its International Director for Strategy, Dr. Montse Daban, and her team, especially Clara Medina. In addition, I want to say hello and thanks with pleasure from the bottom of my heart to Consul of Ukraine in Barcelona, Mr. Valery Cymbaluk. Jakuyu. It's a great honor for me to address you this brief speech. Just a few words to enhance and emphasize my admiration for your participation and congratulate 2 expert speakers, Rosana Alessandrello from Agency of Quality, Aquas, and Katerina Nekrasova, Deputy General Manager for International Relations and Client Service Medical in the procurement of Ukraine. Thank you very much for coming along to share in this relevant session with very useful technical discussions. We want from the Ministry and from the government express our full support to this initiative and show our acknowledgement to organizers and participants. It is very interesting for us to keep this kind of European initiatives for cooperation with Ukraine in the premises of healthcare services. It's not the first time. I remember a very emotional meeting at the Ministry of Health with Dr. Montse Daban and with General Manager of BioCat, Dr. Robert Fabregat, for receiving a team of the cluster about Ukrainian women for health, integrated by best leaders of this country during the second year of invasion. In this seminar today, the organizers have wide experience and they will tackle the importance of institutional leadership, coordination between levels and stakeholders, and feedback and accountability in healthcare services under pressure. Another topic that you will talk about is the value of the take of decisions, evidence-based, and assessment and data as the main pillars for innovations in the resilience healthcare system. I want to remark the importance of this kind of projects as a Cluster4health, as a frames of dialogue and collaboration between public administrations, governments, ecosystems for innovation, and Europeans and Ukrainian actors and stakeholders. I was in Ukraine 2 months ago, in Lviv, Kyiv, Rivne, Kharkiv, and other places, visiting hospitals and with the Minister of Health, very close of the scenario of the terrible war. And next week, I will back again to Ukraine, maybe this time to Odessa, in a humanitarian mission. Before I say goodbye, I want to launch a message of future and cooperation and courage to share experience each other in order to learn from the mutual experience is the best way to profit the talent and knowledge in both countries. So good job and enjoy the session and debate. Thank you very much.
Thank you, Dr. Pujante. That was very inspiring, and good luck and all our heart with you when you go to Ukraine in a few days. So thank you for joining and thank you for your words. And I also want to invite our esteemed Consul of Ukraine in Barcelona, Mr. Vitaly Tsimbayuk. Please join us also here today.
Hello, everyone. Thank you very much, Dr. Pujante, for your speech. As we have translation, I would like to speak in my native language. So, dear friends, estimados señores, шановні колеги, дорогі друзі. Щиро дякую Біокат та ініціативі Clusters4health за запрошення і за сталу підтримку співпраці між Україною та європейськими мережами у сфері охорони здоров'я. Сьогоднішня сесія присвячена ключовому питанню сучасному державному управлінню системою охорони здоров'я в умовах трансформації. Для України ця інформація відбувається в умовах повномасштабної війни, коли публічний сектор змушений одночасно реагувати на кризу, забезпечувати безперервність послуг і продовжувати реформи. У цьому контексті особливо важливо обговорити, які управлінські виклики стоять перед публічними системами охорони здоров'я. Як дані, оцінка та evidence-based рішення можуть покращити прийняття рішень на рівні всієї системи, а також яку роль відіграють координаційні органи та державні агенції у зміцненні цієї стійкості. Не менш важливим є питання управління цифровою трансформацією та інноваціями, так, щоб вони підсилювали прозорість, ефективність і довіру. Досвід Каталонії та практичні приклади з України, зокрема у сфері медичних закупівель, дають цінні орієнтири, які можуть бути корисними для інших країн. Хочу щиро подякувати європейським партнерам за солідарність і підтримку України. Саме європейсько-українська співпраця є ключем для посилення державного управління та побудови сучасної стійкої системи охорони здоров'я. Отже, я бажаю всім плідної дискусії та практичних результатів. Щиро дякую. Thank you very much for your attention. I wish you very productive work. Thank you.
Thank you, Mr. Tsimbayuk. And please, Clara, can you guide us a little bit through the project? And Alina Capitano, we have Alina Capitano. She's the coordinator of the Clusters4health project. Maybe you want also to guide us through the project yourself?
Thank you so much, Montse, for bringing the floor to me. Especially, I would like to say a warm thank you to you, to Montse, to Clara, and to your efforts to organize this very interesting breakfast with Clusters4health and to have such distinguished key speakers and welcoming the project. And it's very important for us, for our community, to have a support of Catalonia in closing the collaboration between Ukrainian clusters, European one and the Norwegian ones, as we have also Norway part of Clusters4health ecosystem. From my part, I would like to mention that Clusters4health is very important to strengthen the collaboration. We want really to contribute to rebuild the Ukrainian health ecosystem and to bring all our knowledge as clusters dedicated and fully committed to healthcare ecosystem to bring innovation closer to the patients. And I would like to highlight this project is fully dedicated to support Ukrainian health cluster, but of course the collaboration between all the clusters that are part of Clusters4health, and to like this to bridge the collaboration between Catalonia, Emilia-Romagna, Northeast region, which I'm representing, the cluster from Ukraine like Rivne and Kiev. Also the cluster from Norway, represent the ecosystem, the Krakow, of course, our host. So thank you so much, and looking forward to the next steps. This is indeed a map. It's a very strategic project. We consider that somehow we are having also some sort of medical diplomacy sometimes in our projects, and it's very important to highlight this because sometimes European projects can really make a change in healthcare and strengthen the collaboration between our region and our countries, and to really play an impactful part of this important current situation, both geopolitically, both in terms of rebuilding the healthcare ecosystem in Ukraine.
So thank you so much, Elena, for this introduction to the project. Now, if we go deeper and we go to this session that we are going to discuss today, we're going to focus on the public healthcare system, governance, and times of transition. So basically what we are going to do is light focus on interactive space in dialogue, focusing on more this modern governance for health. Today we will explore this evidence-based decision-making, system-level coordination and innovation, and how can this be support stronger governance of public healthcare system in times of transition. As healthcare systems face increasing pressure from crises, reforms, and limited resources, public institutions play a crucial role, and ensuring transparency and efficiency and trust, it's one of the key actions from today's. So if we go in terms of our speakers, today we will have the pleasure to have Rosanna Alessandro. She's a value-based procurement director of Aquas, that is the Agency of Health Quality Assessment of Catalonia. So basically, Rosanna, wherever you want, the floor is yours.
Perfect. Thank you very much. I'm going to share. I imagine that I'm going to share the screen, correct? So let me just. In the meantime, let me also thank for the words of the institutional welcome, because really from the consul and also Dr. Pujante, I'm honored to speak after them, and thank you very much for the organizer to inviting me. Really, it's a very nice. Okay, let me share. It is a very nice setting that I can.
We see your screen perfectly, Rosanna.
You see my screen. Very good. Thank you. Thank you very much. Okay.
I have the slides already, so if you want, I can just go through the presentation.
No, as you want. I can. So if you're seeing if you see my screen, I can just go through my screen. Don't worry. I'm fine.
So Rosanna, we are seeing one screen. We don't know if it's yours or it's Clara's.
Yeah, it's my screens.
Yes,
exactly.
Okay, good. Very good.
You don't need to share, Rosanna.
You don't need to share. Very good. Thank you. Okay, good. Thank you very much. Okay, but I don't know why I don't see the screen. So now I see it. Okay, very good. Okay, I'm here. Okay, so let's. So I don't need to introduce myself. So let's go to the next screen. Just a brief introduction of Catalonia that I'm sure that you already know, since Monse Daban and Biocat already making part of the cluster. By the way, we're talking about more than 8 million of inhabitants, more than 12,000 millions of budget, and the universal coverage. And what I would like to highlight here, that we have clearly a diverse kind of healthcare center providers, more than 2,000. And the most, I would say, concrete item that we would like to highlight is that we have more than 16,000 kind of applications across the Catalan systems. And this is somehow is done also because what we aim for is that each of our healthcare providers in their healthcare specialties can use what fit for purpose better for them. But what we aim for is an integration and the collection of all the data in a common data repository that we have here in Catalonia already since the beginning of this century, I would say, millennium. So let's go next. Aquas has been working in innovation procurement, value-based procurement since 2012. And as you can see, I would not go through each of these projects. I would just to highlight that working this kind of project it does not mean, or the kind of initiative doesn't mean that you just work in procurement, because this kind of procurement, you need to create knowledge and you need to create learning little by little to get insights on how to finally ensure a right transformation of the health system and the right governance, as this session is about. So not only we do PPI, public procurement of innovation, and pre-commercial procurement, and these are the projects with this frame in blue, co-funded by European Commission. These are important instruments, these co-funds for European Commission, because are somehow supporting us to work in cross-border, to learn from each other, to create a challenge, to define a challenge that does not only affect healthcare providers from Catalonia, but affects maybe healthcare providers from France, from Italy, why not from Ukraine, in a way that there is this exchange of knowledge continuously, and also in a way that we share the risk together. And because at the end, adopt innovation, adopt research and development, clearly there is always a risk, but also that we are stronger in front of the market because we are more attractive. One thing is that the market is addressing one issue just detected by one healthcare provider in Catalonia. Another thing is addressing a challenge that is being defined, identified in a healthcare provider or one or more in Catalonia, and two in another, France, UK, well, UK no longer, Italy, and whatever country in Europe. So somehow already the market dimension, the opportunity for the market is bigger, and so we are more attractive. By the way, sorry, 1 second, let's go back 1 second. So, by the way, when we work on this, then we need also to know how to make a capacity building. So, more we go through this journey, more we learn how to do it, and more we need to boost our healthcare professionals to identify their challenge, to adopt innovations in the healthcare providers. Also, working in community of practice and ecosystem is key. So the project framed in green. And then also we have also project public information boosted already from our own payer, the Cat Salute, in our Department of Health. And so we had also some initiative already initiated internally, so without going through a competitive project through European Commission, and these are framed in orange. And then we have also project, and this is very important because this is somehow we initiated this from 2020 on, to understand the readiness of the transformation of our healthcare provider and of innovation to be adopted and to match it. So somehow to depict the adoption of the innovation, so of this transformation, thanks to the fact that we are innovating, to depict the pathway. And maybe once we know what the transformation we want to do and the innovation we want to adopt, we will understand from which healthcare provider we need to start, and then depict this pathway across the health system. Now, next slide. Thanks to all the work we did, we are proud to say that also we have won some awards and mentioned some France juries. Next slide. Why we are doing it? Through public procurement. Why public procurement is a strong instrument? Because for approximately 14% of the GDP is invested in public procurement across Europe. And on the other side, we have the less of 25% of the R&D grants results get commercialized, and more than 50% of the public contracts do not achieve their goals. So public procurement of innovation, value-based procurement is really a very strong instrument to ensure that then this major investment we do in procurement can ensure that the innovation gets commercialized and at the same time give answers to the procurers' needs. Next slide. Another topic that also we like to highlight is that every time that we do transformation, we maybe we adopt new technologies, maybe not. Maybe it's just we are procuring services, maybe we are procuring some other, no, there are different kind of procurements. But in the case of medical devices, it's important to see that there are some barriers to the diffusion, especially when exactly we are talking about innovative medical devices. And there is this systematic review from 2021 that is very interesting because it's somehow identifying the major barriers to the medical device diffusions. And as already as we can see, there are these are the ones that are in these slides are the most relevant ones. If you go to the article, you will see the full list. Now let's stay here. The most relevant, as you can see, are technology specific, clinical evidence, regulatory affairs, health technology assessment, reimbursement, and adoption. If we look at clinical evidence, health technology assessment, reimbursement, it's already clear that part of the limits to adopt technologies is because at the end they don't generate the evidence that were expected. There was no plan to generate such evidence. The health technologies assessment again was not taken in consideration since the beginning, and so the reimbursement somehow failed. This is interesting. This article is looking at the US. It is looking at and is sort of covering the FDA, all the technology that were applying to the FDA, and just fewer than 7% of the devices achieved implementation. Next slide, please. So what we are doing in Catalonia, where we were moving from a model where we have innovative healthcare providers, where we have innovative hospital, we're innovating the process, in the product, we validate innovative products, and we do procurement of innovation, to next slide, to expanding healthcare innovations in an ecosystem way, where we create new knowledge, new agents, new business models that align to the business case of the healthcare provider, new dissemination models, and new tools for funding. So this is very important also from reimbursement perspective. Yes, next slide. How we are doing in Catalonia when we were used not to work with and we are still used to work with some specific innovation pockets where that we are using such innovation pockets for ad hoc innovation and value-based procurement, or for also specifying some reimbursement for ad hoc innovations. And since last year, together with BioCat and with the support of our payer, Casalut, we put together the instruments called PASS and the InnoPass, that is supporting to selected initiative to receive personalized support program to get then up to speed and then ultimately to be adopted by our health system. We launched a call last year, and to get this innovation support, you need to have already a high maturity level and then have the potential for clinical and organizational and social and environmental impact. And then also the future is not that we have just ad hoc innovation in value-based procurement, but it's already a program. This is what we are working on to enabling the implementation, adoption, and scale up of transformation and bringing so value to patients and citizens. The value chain, patient and citizens, healthcare professionals, healthcare providers, health system and payer, and the society and the environment as a whole. So this is somehow where we are aiming at together in parallel with the different instruments. Next slide. We are working, we started with individual, putting together a governance. We have a specific subcommission dedicated to value-based procurement of the Commission of the Innovation and Transformation of the Department of Health. We do strategic foresight. We start now working with projects and developments of implementation framework. We develop methodology methodology, we promote the innovation cultures, and we evaluate what we do, and we maybe we also affect the strategy again, and we do these virtual circles. Next slide. So, as I said, our transformation is based on on the value chain. So we need to go from patient and citizens across professional health providers, healthcare system payer, and the social, economic dimension and the environmental. And then this transformation is very important that also is supported by the market. So also we need to bring value to the market to ensure that we do this transformation. The basis of our transformation is based on the theory of change. Every time that we now want to transform our healthcare system, we always start from the impact we want to generate. Then we go back to the outcomes, to what outcomes we need to generate to generate such impact, the outputs. We identify our inputs, who we are, what are our skills, competencies, the infrastructure we are making available, and so we can define the activities. And so this is somehow how we work. Next slide. And this is the framework that I was also explaining to you, that every time we do a transformation, we need to define our starting point. We need to identify if such a transformation already generated some evidence and already has been adopted by who. So if in the case that is we are still in the research and development, so we are in the phase from design and proof of concept, really no one is really still adopting it. So, and still we need to create some evidence. And so we evaluate, from there we define what evidence we need to generate to go to the next step. Once we are clear that we are ready to implement, we can go to level 1. And the implementation is already done with the technology, with the transformation that already generated such evidence. So it's not just the evidence of the technology, no? It's the evidence that this technology is creating the outputs and outcomes that I was expecting. Once we have in level 2 that this transformation has been carried out successfully, generated the evidence we were expecting for level 2 to one or more healthcare provider, we can go to maybe already thinking to scaling up to our health system if we are generating the evidence we need, and go to level 3 where we can think about to scale up across different health systems across Europe. We are using this framework in the personalized cancer medicine in different action from the European Commission, and now this is the basis, for instance, for the joint action in personalized cancer medicine. Next slide. And also in InnoPass, by the way. Every time that we do procurement, we think about the value we want to bring, the risk we can to take, and the evidence that we need to generate. And so once we are clear and about these 3 elements, we look at the level of preparedness of who is adopting this transformation, the level of preparedness of the innovator who will bring us the value to generate some transformation. Once we are clear on these 5 elements, in fact, we can now depict the adoption pathway. Next slide. And finally, the evaluation. The evaluation, every time we do a procurement, we need to evaluate the needs, are real needs. We need to identify also if this concept is viable for us, and is feasible for the market. And then we go through all the evaluation process across this procurement. We evaluate the outputs and the outcomes that we generate across this transformation. And then we do a final evaluation where we evaluate still, again, the outputs and the outcomes, but also the market, how responded the market, how the buyers, how they experience this transformation, the economical operators that we do interview with the economic operator that were participating to the market consultation, that were submitting a bid, but maybe they were awarded with the contract, and also the ones that went through all the contracts. And also, why not with the policymakers? So in this way, we are clear about the lessons learned that we generated across such transformation process. Next slide. This is just to mention that we are now involved in a new project called HIPS, that is again like a community of practice where we want to create sustainable, scalable services around health innovation procurement. And we are the next slide. And in the case of we are services for related with project systems and also legal support. Next slide. And what we would like to mention that since we are an agency from the health system, we are really interested and keen to understand how to promote this kind of way of working, adopt innovation procurement with other health systems. So we did a review of the grey literature, health system analysis with expert interviews. We did a workshop with stakeholders. We did a literature review, and we did an exercise of analysis and synthesis. Next slide. And we identified some elements that we like to mention here because they are a space for creating collaborative space, and this would be maybe interesting, and like to identifying there is a triangle. This image is the one below, sorry, that is policymakers, providers, and health managers. So how we can dynamize from health system level this triangle, then also how we can all together think about in our health system how to review together how we can build policies and projects from one side demand driven that are the innovation procurement, value-based procurement, from the other side that are technology driven, like maybe precision medicine, maybe AI, and researcher driven. Next slide. How we can also share all together tools that we can be adopted or adapted from the different system in innovation procurement. Next slide. How we can identify and analyze local gaps and create a theory change from systemic level. How, if we want to adopt innovation procurement, value-based procurement from 5 years from now, what we need to seed now, to see the plant grows and have new flowers in few years from now. That's all. Thank you very much.
Thank you, Rosanna, for making this overview on the evidence-based governance from the Catalan perspective. Then I'm gonna give the floor to our next speaker. Sorry in advance for my pronunciation. She's Yulia Shukulukia, Head of International Cooperation Unit at the State Enterprise Medical Procurement of Ukraine. So, Yulia, whenever you want, the floor is yours.
Thank you, and I would like thanks for this meeting and this opportunity to take part in this business breakfast. I suppose it would be very helpful, and if someone will have the additional questions, they can get us by this QR code. There is all necessary information, and will be the contact also information at the last slide. Can you bring to the another one? Yes, thank you. The medical procurement of Ukraine was established in 2018 like an option on the healthcare reform. And this is a national agency in Ukraine that transforms medical supply chain to improve the quality of the life of Ukrainians by procuring centralized of medicines, medical devices, and equipment. If we talk in general about streams, we can outline 4 main streams. The first one, this is about the all supply chain and ensuring this management to healthcare facilities in Ukraine. The second one about the digitizing of the medical supply chain system through development our own IT solution or using the innovative and modern solution that are on the market. The third one, this is implementing innovating procurement tools and mechanisms to improve access of Ukrainians to limited or higher costed medicines. And the last one, this is the administration procurement tool. It's called e-Catalog, Prozora Market. It's like a marketplace to procure medicines on the regional level, and it's the tool that helps to procure fast, trackable, and very useful. The next one, please. If we're talking about the numbers, in 2024, the year before, at the centralized level, we procure the medicines and medical devices and equipment total cost on this amount, and this is within the centralized program. So this is within the budget money. It is more than 97 of the quantities that was confirmed for Ukraine. We not due to some budget challenges, we not cover all the demands that in Ukraine, but we trying to introduce in our procurements more innovative tools and mechanism to procure more. And another stream also, this is donor funding streams. There is a United 24 platform. This is fundraising platform which was initiated by the President of Ukraine, Volodymyr Zelensky. And we procure the medical devices and equipment for hospitals within the medical part of this program. About the transition time, we had experience with this within the few challenges. The first one challenge it was of course COVID, and the second one come with a full-scale invasion. And we faced with such challenges like logistic disruption in medical supply chain system, economic instability because every day the rules was changed, the exchange rate was changing. The incomprehensive rules of the game. What does it mean that the procurement law at the beginning of the full-scale invasion has changed many times for the year, for example? We have to first adapt to this to procure and to survive. And also this is infrastructure destruction. This is also about the healthcare facilities destruction and the road destruction. What does it mean? As the year before, we have procured the MRI for Kharkiv region hospital, and there is some missiles in the hospital, and it's all like one of more challenges that we had. About the key factors that helped us to build system and to adapt to these challenges. This is the main four. Of course, this is could be wider, but if you talk about the main, this is the partnership and international support. At the beginning of the full-scale invasion and in the COVID time, we call to our partners about the capacity building support, about the international support. It's also the humanitarian aid support. Many of manufacturers in Europe help us buy humanitarian supplies of medicines in Ukraine, and it was very helpful. This is successful also implemented digital solution for end-to-end procurement process. Even these challenges, we understand that it's important to procure and that this is should be relevant for all stakeholders to see what procure, in how way procure, and how many procure. And these all digital tools will help us to demand collection, to procure in the amount that they needed, and to track all these procurement supplies. The third one, this is agile business processes for rapid response and including enhancing logistics. And the last but not the least, it is the team of professionals which work on the missiles with blackouts, with power cut-offs. But in this time, it was very important and very helpful to build the team and the structures that work even in such challenging time. On this slide, this is the 3 main focuses that I'll describe in detail how it's work and which cases and solutions helps us. If we're talking about like before the digital supply ecosystem, the building of this system is help us to evolve challenges and also growth of our organization to adapt our business processes and help us to digitalize procurement processes. Here is the 2 streams. The first one, this is centralized procurement. This is procurement under the budget funds. In this stream, we use 2 digital tools. The first one, this is SAP Ariba. This is a global market solution. We use it for market consultation with supplier communication. When the supplier wants to involve on our tenders, we can share our tender annunciation, tender schedule, and etc. And of course, I suppose many of you knows about the Prozoro. This is the obligatory procurement system in Ukraine, and all state enterprise should use it for the public procurement. And we also conduct our centralized procurement through this system. When we're talking another stream, this is the regional procurement, because we administrate electronic catalog, which is called Prozoro Market. This is one of the procurement tools which help simplify the conduct of regional procurement by healthcare facilities, and it can be used by ourselves to procure fast and trackable. And all these 2 streams also through this have such a digital backbone, like all for all our levels. This is our own digital tools like YesTalk and MyData, which help us to coordinate our demand collection, verifying, communicate with healthcare facilities, and etc. And also the one more point, this is in such challenging time have a electronic document workflow and cloud storage to have the opportunity to operationally work with all documents and have the access in any time in this moment. The next one, this is comes from the logistic disruptions that I mentioned before. At the beginning of the full-scale invasion, we understand that we need our own warehouse to diversify the logistic risks of disruption of medical supplies. In this case, in 2023, we merged a warehouse into our operation and become a full-scale agency with covering procurement, which was before, and also storage and distribution to healthcare facility across all Ukraine on the all government control regions. Within no, the one before, please. Yes. Within this case, we understand that the strengthening our logistics capacity also will help us to digitalize workflow. And our next steps is to implementing the WMS system, warehouse management system, to help improve this inventory visibility. Yes, and the stream about the procurement. As a procurement agency, we advance in procurement practices and implementing a new mechanism what help us in this time. This is the introduction of managed entry agreements for innovative medicines. This is such type of agreement used to secure access to innovative and most often high cost medicines through direct negotiation with manufacturers. The prices and the quantity is confidential, and this allows us to achieve more significantly lower price compared to the standard market condition, and it's helped to make the access to the Ukrainian more relevant. The next one, this is the the previous one. The next one, this is the use of non-price criteria in medical procurement. We understood that not always the price is a good option. That is why now we consider and expanding our knowledge and methodology regarding the use of non-price criteria. It will help us to ensure procurement decision and make more evidence-based decision regarding the quality and reliability of supplies. And in August 2025, we conducted our first pilot procurement using non-price criteria. This was in particular delivery timelines. And we are planning this year to further development of applying this approach. The one more stream, not yet, this transition to the 3-year procurement planning. The all years before, we procure year by year. It depends on because of the budget year, because we have the procurement year like 1 year, 1 calendar year, and 2 years before, we shifted from annual contracts to 3-year planning. And it helped for us. It helped us to reduce some gaps in medical supplies. For manufacturers, it helps them to plan their schedule and delivery times. And the last one that I would like to highlight is this is exploration of joint cross-border procurement mechanism. This is one of the topic themes of in Europe. The pool procurement now is a mechanism that helps to procure more effective and such medicines like could be reached by in some region. And Ukraine in 2025 signed a joint procurement agreement, which was the starting point to make Ukrainian market open for the pooled procurement mechanism. And this mechanism should strengthen the procurement power, and we will start to develop and starting this mechanism further. This is the most important streams that help us. And at this slide, you can, if you have any additional question or you have some comments, you can reach out us by all these contacts.
So thank you so much, both speakers, for these insightful presentations. And just to remember that this also, it's a good opportunity just to share information, to share thoughts, and it can also be an open discussion. So I would just encourage that if any one of the participants, the speakers, would like just to share with us or to share with us some thoughts, now it's also the good time just to do it. So, but if not, we can also just share with you some questions that can be also just at least interesting just to reflect, I think. And sorry, because I can't see the screen. So if anyone just would like just to raise your hand and speak, just please go ahead.
I would like to thank also the speakers, and I would to ask one question to both, but also I am sure that Rosanna and Julia have questions for each other and many questions from the people in the room, in the virtual room. But I have a question that it was kind of struck me, the one sentence that I heard, and it links both of your presentations. Actually, it's not the evidence of the technology, but the evidence on how that we get from how this technology provides what we expect. And I think that this is really aligning the technologies to the challenges that it has to solve. And I think that for Ukraine, this is a very specific moment to face the challenges with the technologies, but also in any region, in any ecosystem. So I don't know if you want to link a little bit on that, or probably comment among you, because I think that this is both for you. It's a valuable insight.
I don't know, Julia, do you want to start or I start?
You can start.
Okay, thank you. Okay, I start. Yes, Mons, that's to us is very clear. When we adopt some technologies, if this technology is transforming us, no, how we are working, or how we are delivering health provision, or how we are, and I'm talking about technology in a wide sense now, not just hardware, or software, but technology in a wide sense, like in a health technology, technology can be also a new procedure, a new process. So every time that we adopt this, that is replacing the way that we are working, we are transforming something. And this transformation can be maybe just the hand of the surgeon. Then we need to learn a new technique, but it can be also that we are changing the role of a healthcare professional. Maybe the nurse was doing some task and now needs to do other task. Or maybe also the lab, when maybe we don't know, a sample before, a blood sample before was going through a pathway, now we are changing completely. So all of this needs to be taken into account, because maybe it's creating additional needs of training, or additional needs of additional personnel, changing the role of the personnel, and new task, replacing some task, and maybe also freeing up professionals, no? Because at the end of the day, maybe we are doing this because we freeing up the time of some healthcare professional to maybe to have an impact, in fact, reducing some aspects that we want to reduce. So we need to take them into consideration from the beginning, and we need to measure this impact in a way that is not just clinical outcomes, is all the process outcomes, and include also the clinical outcomes. Very important, because let's imagine if then we disrupt completely then the health of our citizens, or and also that's a very important component when we are looking at it from the eyes of the health system, that also we need to think about that initially maybe we are adopting this change, this transformation in healthcare provider for health provider, but then we want to be that such transformation is equitable, no? So that reach everyone. And also we cannot just do something that then just few citizens in an area can take advantage of it. So also this needs to be also taken into consideration from the very beginning. So yes, it's not just the technology, it's the full transformation to ensure that the technology is implemented and adopted.
Thank you, Rosanna. I don't know, Julia, if you want to add here something, or just because we have like 3-4 minutes maximum, but I think it's very important. No, that's the point. It's very important that we have this this connection, and also your exchanges.
Yes, thank you. I would totally agree with Rosanna, because of this is really important. And the previous one, the last one slide I shared, this is also about not only the approaches and tools that we applied. This is also about the all mechanisms that helps to agile all the processes to put in together and help us to make evidence-based decision. Because at the national level, it is important to take into account all of this information and all of this technology and all of these approaches help us to make more, let's say, more important decision to make supply more evidence-based.
That's perfect. And I don't know, Clara, may I continue? Because I know that you opened the floor to comments, but I think that this is a very important project to not stop today on this exchange, but I think that is a very good opportunity. And this is, I think Clusters4health is great for that you can start also seeing, because there's two last questions. What lessons from Catalonia and Ukraine are transferable to each other system? I think, or to other health systems, I think it's a key question for this meeting today, and also how we can, our collaboration, make our public sector governance stronger and more focused on the transformation. So I don't know if you have a last words for that, or as somebody, I don't know if there are questions in the chat, I cannot see it, but anyway, how do you, like a last word about how we can just continue with your support from there?
Well, really, it's a very, sorry, Tatiana. There is Tatiana Voronstova with the...
Yeah, Tatiana, I think you have
звук
your...
не включила. Ты подняла руку и не включила звук, Таня.
I can give the question. Okay. Hello for everybody. Thank you for Sana and Julia for this exciting presentation. And I have some question for Julia about innovation level of agreements, that innovation level, innovation product, innovation drugs can appear in Ukraine now. And what about the future of a period of TMP drugs in Ukraine for this level of agreement? Because even the Interregional Medical Cluster is members of Consortium Precise EU, and with the lead of Biocat about and the main goal of this project is to bring these innovation drugs to our people. And it is very interesting how you can prepare and about this appears drugs in Ukraine. Thank you.
Yeah. Within the stream, the procurement innovation.
It's about the ITMP drugs. It's not about as such an entrepreneur says it about the any cannabis drugs or others. Is ITMP for treatment of patient with genetic and other for precise medicine. Thank you.
You mean Tatiana, advanced therapies?
Yes, advanced therapies, Monsi
Okay.
said. Thank you.
If you talk about some specific list of medicines or some specific drugs, and within this concrete stream, it's decided on the side of the Ministry of Health, because the list of medicines and medical devices is approved by the Ministry of Health, and the final decision always on their part. We also communicate and can make some advice for that, but always the final decision on the regulatory bodies.
Mm-hmm. And for now, you don't prepare for appears these drugs in Ukraine, yes? You don't about this.
For now, we have a little bit more different streams. And within the streams, when it's not, let's say, when it's not approved, we can say that it can be, because as I said before, the final decision is not at our side. We can only, let's say, confirm after the confirmation from the state government.
Mm-hmm. Thank you.
From what I know also, Tatiana, because Tatiana and us and other partners here are partners in precision medicine, Precise EU and Precision Medicine project. What I've heard also is that this is Ukraine is not a member of the European Union for the European for the European Medicines Agency authorization regarding advanced therapies, ATMPs. This is not automatically covered by EMA in Ukrainian's case, but and probably I don't know if you have, like Julia said, of course your strengths, but there's more and more a regulatory alignment, and I think this is a very important subject, because when the single market is totally deployed with Ukraine also at fully participation, or when the widening for the European Union is effective. So this is going to be very important as well. So I think that there initially Ukraine is aligning from the Ministry of Health to the EMA for ATMPs, if I'm not wrong.
Okay, so thank you, Monse. I think we have time for just one last question or thought. Maybe Natalia, I think you have your hand raised.
Я хочу подякувати всім нашим учасникам. Я бачу, час вже у нас. І я хочу нагадати, в принципі, Юля не розказала тут тільки про те, що ми фактично реально були в викликах замовлень і інновації, замовлень від лікарень. Інновації, які є у МЗУ, треба вивчити. І те, що робить, наприклад, з чим виступає Ігор Луценка. Юль, я дуже б хотіла, щоб ти теж це показала, розказали ви світу. Ви це розказуєте, але є можливість зараз з Каталонією разом зробити спільні проекти, поділитися досвідом, обмінюватися. Тому я запрошую наше керівництво МЗУ. Юлія, сподіваюся, що ти як керівник міжнародної співпраці, кооперації проєктів зможеш все ж таки знайти точки дотику і розказати те, що ви вже зробили, бо те, що я знаю, я не буду говорити ні про наглядову раду, яку ви створили, не нові методики, взагалі управління ефективністю підприємством під час війни. А те, що ти розказала, це дуже добре. У вас є ваша сертифікація повністю. Це настільки викликів багато, що є про що говорити навіть окремо. Тому я пропоную все ж таки далі продовжити спілкування. У нас є Клара і Монсі, так? І продовжити спілкування саме з тими реальними інноваціями. Це інновації, що ви зробили. Ділитися і інтегрувати те, що є і в Каталонії, і те, що є у нас в Україні. Я дуже дякую всім учасникам.
Thank you, Natalia. I don't know if anyone just want to have a feedback on that, but I think we arrive at the end of this breakfast session. I hope at least this provided useful insights or inspiration, at least. And of course, we warmly invite you just to stay connected through the Clusters4health community. And of course, also on our upcoming breakfast sessions, just to remember they are focused and based on the actual challenges that Ukrainian ecosystems are facing and all these needs that they are just going through right now. So thank you so much once again to all the speakers, all the participants, and all the partners who are involved in these breakfast sessions, and just hope to see you next time. I think maybe Monse wants to add some comments.
Yeah, no, just a very last reminder that you will have this recorded in YouTube channel for Clusters4health. So that's a very useful for everybody. And well, just finishing this session with the recommendation to look through all the other Cluster4health breakfasts, because those all have been very interesting for everybody. So just a final comment.
Totally, Monse. So thank you so much. I think I'm seeing Emma having your raised hand. So if you want to add something.
Yes. Hello. Maybe I will just put my camera on. I was invited today to tell a few words about. Wait. My cat tree is in the background, so I hope it doesn't mind. I was invited to tell a few words, like 5 minutes, about an initiative that you could join, as it's in the topic of procurement. So if someone of you has 5 more additional minutes, then I will be happy if you stay. Maybe to just make it easier, I would share a screen, because there will be a QR code that you could use. So just let me share my presentation. Yes, so just to be quick, today I represent the ReHeal project. We are a partner in this project. You can go to the second slide, Asia. So the project aims to transform healthcare supply chains across Europe, shifting them from the traditional linear take, make, dispose model towards a circular approach that is more strengthens the system resilience, reduces the waste, and supports climate-friendly innovations. And as I said, we are one of the project partners besides Scotland, Spain, Greece, Denmark, and yes, next slide, please. So the objective is, like I said, ReHeal brings together a buyer groups of leading healthcare organizations along with a broader community of innovation and research partners to build a scalable, evidence-based model for circular healthcare that can be replicated across Europe. That's why I thought it would be interesting for you and the participants to listen to the followers community that we are building on the Life Science Open Space platform. So the followers community aims to gather the representatives of research, innovation, healthcare system providers, and why it is important for us, for you to join. It's because we will publish all the recent information, news, events that are happening in the project. And the project aims to organize open market consultations soon, next month, in all of the partner organization cities, but also online. So there will be one in February in Krakow, but also in Spain, Greece, Scotland, etc. And the open market consultation that will be published on the followers community this week, they will inform potential suppliers about the ReHeal procurement process opportunities through events, through surveys, matchmaking services. So all the materials will be published there in the followers community. And the open market consultations are the first step for the calls for tender. And the calls for tender is a pre-commercial procurement, which will invite suppliers to submit proposals and explain the budget, deadlines, tender requirements. So all the information about the calls that will invite potential suppliers will be also published on the followers community. So you can scan the QR code and create an account. I think most of our project partners already have some accounts on the platform. So the only thing that you will have to do is to join the followers community, and we will accept you. And it's still growing, so we will publish all the new news and events this week on the platform. So I thought this opportunity would be of interest for you. So I hope that you will join, and we will see you in the followers community soon. So thank you, and have a good day.
I just have a question. Is there any limitations who can join?
No limitations. Okay. You're free to join.
Okay, thank you very much.
if you need support in creating the account, me or Asia, Joanna,
you can contact us. You have
yes.
the link to our platform on the chat. And
Okay, so once again, thank you all. And I think I can say that see you on next breakfast session on March 4th.
thank you very much. See you.
Thank you very much.
Thank you. Thank you very much.
Thank you.
Thank you.
Bye.
Thank you very much to all
Thank you.
and the organizers as well.
you.
Bye-bye.